Hi, my name is Edgar Moises Martinez Sanchez, and this is my partner Brisa Guerrero Hernandez of Escuela de Medicina Unidad Norte, belonging to the Universidad Autónoma de Coahuila, who, to begin with, will first give a brief orientation to our subject, called varicose veins in the lower extremities and their treatment within the circulatory system. Although there are numerous pathologies that involve the appearance of varicose veins in different anatomical sites, such as the testicle and the esophagus, to mention a few. We gave it a focus on the lower extremities due to the high prevalence of pathology in our country.
The purpose of the information obtained is to inform the student population about this issue, which does not take on the necessary relevance, despite the frequent occurrence of the disorder itself, bearing in mind that without proper treatment, it can bring serious complications to our health, in addition to the aesthetic problem that leads to the female gender, although it appears in both genders. Varicose veins are important in the circulation system, and that's why we want to introduce some relevant points in our presentation as concept, epidemiology, because it is important to know the prevalence of the disease, etiology, signs and symptoms, risk factors, diagnosis, complications, prevention, and of course, the treatment as surgical and conservative.
Okay, let's start, Brisa. First of all, varicose veins are veins that have become enlarged and twisted that you can see under the skin. They are often red or blue in color. Can you imagine it? The term commonly refers to the veins on the leg, although varicose veins can occur elsewhere. Although they can be painful and disfiguring, they are usually harmless. About the epidemiology, in Mexico, the Ministry of Health published the Yearbook of Morbidity in 2015. There, they classified this pathology within the 20 causes of national disease. Venous insufficiency of the lower extremities is a disease of high prevalence. Approximately 70% of the Mexican population suffer from this pathology, where the most frequent age rank is 25 to 44 years old. Worldwide, prevalence affects between 10 and 40% of the adult population, especially in the lower extremities, according to the latest studies. Chronic venous insufficiency affects 50% of the population that is over 15 years old. It's more common in ladies than in men. Cutaneous changes are common and symptoms are few, which is why it has been generally underestimated as a condition that is later recognized by its complication.
Okay, now let's talk about the circulatory system. As you know, it's a closed system in which the circulation of blood in the blood vessels is forced by a cardiac action pump. This system can be compared to a network of tubes of different diameters, created by two types of blood vessels, arteries and veins. Veins are blood vessels that contain low oxygen blood that goes back to the heart and lungs. The veins of the lower extremities are divided into the deep veins hidden below the muscles and connective tissue, and the superficial veins located just below the skin that are easily visible. In the layer of superficial and deep veins, there are valves that allow blood to flow in only one direction, preventing from receding. In varicose veins, the valves do not work properly, allowing blood to pool into the vein and making it difficult for the muscle to push the blood uphill. Instead of flowing from one valve to the next, the blood continues to pool in the vein, increasing venous pressure and the likelihood of congestion, while causing the vein to bulge and twist. Because superficial veins have less muscle supporting deep veins, they are more likely to become varicose. Actually, according to the clinical, etiological, anatomical, pathophysiological classification, C0 means no visible or palpable signs of venous disease. C1 means telangiectasia or reticular veins. C3 means edema. C4 means pigmentation or eczema. C4b means lipodermatosclerosis or atrophied flange. C5 means heel venous ulcer, and C6 means active venous ulcer. Well, let's talk about risk factors. According to the Mount Sinai Hospital in New York, risk factors include older age, being female, as hormonal change, pregnancy, menopause, being born with defective valves, obesity, history of blood clots in legs, standing or sitting for prolonged periods of time, and, of course, family history of varicose veins.
Now, in some symptoms, the presence of tortuous-dilated subcutaneous veins is usually clinically obvious. These are confined to the lung and lesser saphenous systems in approximately 16 and 20% of cases, respectively. The distribution of varicosities may indicate which superficial system is effective. Besides being unsightly, varicose veins commonly age and cause a sensation of tiredness in the legs. However, many people, even some with very large veins, have no pain. The lower part of the legs and ankle may itch, especially if the leg is warm after a person has been wearing socks or stocking. Itching can lead to scratching and can use redness or rash, which is often incorrectly attributed to dry skin. Phlebitis may occur spontaneously as a result from an injury. Patients can also experiment fullness, heaviness, thigh or calf cramps. If flow of blood through the veins becomes worse, symptoms may include leg swellings, leg or calf pain after sitting or standing for lengthy periods, and skin color change of the legs or ankles.
Complications. Most varicose veins are reasonably benign, but severe varicosities can lead to major complications due to the poor circulation through the affected limb. According to Goldman's book, leg veins patients can experience: number 1, skin ulcers near the ankle. Number 2, development of carcinoma or sarcoma in long-standing venous ulcer. Actually, over 100 reported cases of malignant transformation have been reported, as a rate as 0.4 to 1%. Number 3, blood clotting within affected veins, termed superficial thrombophlebitis. These are frequently isolated to the superficial veins, but can extend into deep veins, becoming a more severe problem. And number 4, acute fat necrosis can occur especially at the ankle of overweight people with varicose veins.
Now, in the treatment, we have two options. First, non-operative treatment of varicose veins. Patients with varicose veins may complain of unsightly appearance, aching, heaviness, pruritus, and early fatigue of the affected leg. These symptoms worsen with prolonged standing and sitting and are relieved by elevation of the leg above the level of the heart. A mild amount of edema is often present. More severe signs include thrombophlebitis, hyperpigmentation, lipodermatosclerosis, ulceration, and bleeding from attenuated vein clusters. A vital component of treatment for patients with varicose veins is the use of elastic compression stockings. Patients may be prescribed elastic stocking with compression ranging from 20 to 30, 30 to 40, or even 40 to 50 milligram of mercury. Stocking range in length from knee height to waist height, and they should cover the symptomatic varices. Elastic compression provides sufficient relief of symptoms in many symptomatic patients. Cosmetic concerns may lead to intervention. Additionally, interventions are warranted in patients whose symptoms worsen or are relieved despite compression therapy, or who have lipodermatosclerosis or venous ulcer.
Surgical interventional treatment of varicose veins. Randomized trials of symptomatic patients with varicose veins have demonstrated improved quality of life with interventional treatment. Interventional management includes injection, sclerotherapy, surgical therapy, or a combination of both techniques. Sclerotherapy acts by destroying the venous endothelium. Sclerosing agents include hypertonic saline, sodium tetradecyl sulfate, and polidocanol. Elastic bandage are wrapped around the leg after injection and work continuously for 3 to 5 days to produce apposition of the inflamed vein walls and prevent thrombus formation. After the bandage are removed, elastic compression stockings should be worn for a minimum of 2 weeks. Complications from sclerotherapy include allergy reaction, local hyperpigmentation, thrombophlebitis, DVT, and possible skin necrosis. Patients with symptomatic DSB or SSB reflux may be treated with endovenous ablation techniques or surgical removal of the affected vein. These techniques are generally associated with more rapid post-procedure recovery than traditional open surgical stripping of the DSB. Complications associated with DSB stripping include ecchymosis, lymphocellular formation, DVT infection, and saphenous nerve injury. DSB stripping is associated with a lower rate of recurrence of varicose veins and a better quality of life than saphenous femoral junction ligation alone. Larger varicose veins are best treated by surgical excision using the stab avulsion technique. Stab avulsions are performed by making 2 mm incision directly over branch varicosities, and the varicosity is dissected from the surrounding subcutaneous tissue as far proximally and distally as possible.
And finally, in conclusion, we can add that every doctor or student should have basic knowledge of the following points that we discussed above. Number 1. Now that these are very frequent diseases, especially in the female population. Number 2. There are multiple risk factors that are common to perform in our society, such as staying in a standing position for a long time, pregnancy, obesity, and family history. Number 3. Early diagnosis is very important to avoid any complication in the future, such as ulcers, carcinoma, or venous insufficiency. Number 4. We must know in detail the clinical presentation of the pathology in the patient, identifying its main characteristic, the veins dilated. Number 5. It's necessary to look for the signs and symptoms. Number 6. Finally, as is known, prevention is the essential part that we must know to help as much as possible our patients, both healthy and at-risk groups, guiding them and explaining the importance of maintaining a healthy life. In addition to telling them that it's important not to adopt sedentary lifestyle. We hope this information presented will be useful for students, doctors, nurses, and the public. Thank you very much.